Okay. Good afternoon, everyone. Welcome to 20dB FB Live. I'm your host for today. My name is Rosita, clinical audiologist at 20dB Hearing Klang outlet. So today we'll be going a bit different than our previous live. We are having a special guest. Okay, let me introduce our guest. He is Dr. Vincent Tan, and a consultant ENT and head and neck surgeon at KPJ Klang. He completed his undergraduate and postgraduate masters in ENT from UKM, diploma and MRCS from Royal College of Surgeons of Edinburgh, UK, and postgraduate certificate in allergy from Southampton University, UK. He furthered his subspecialty interest in rhinology and otolaryngite allergy by working as clinical fellow in Singapore General Hospital. He also has published many papers in local and international journals. He has just launched a handbook on ENT allergy for the medical community and also has been invited to live TV show to discuss about ENT topics. So basically for today, Dr. Vincent will be sharing about ear care, urgency response to common ear condition and also hearing loss. If you have any question or concern regarding our topics for today, feel free to write in the comment. We will read and answer in the Q&A session at the end. So now, let's welcome Dr. Vincent Tan. Hello, Doctor. Your line. Hi, Doctor. Can you hear?
Okay, sorry. Thanks for having me here. I think this is this kind of the time. So we know issues. Can you hear me well?
It's like not very clear.
Hello.
Okay, can now okay. So
Hello.
hello. Okay, Doctor, I can hear you. Okay.
Hello.
Hello. Doctor. Good.
Hello.
Hello. Can you hear me?
Yeah, I can hear you.
Okay.
Am
now
I live or is a connection problem? Is there a connection problem?
I think this time is okay. Just now it's quite bad.
Okay, I'm not sure what happened. All right, so good afternoon to everybody. Okay, rewind. Good afternoon to everybody. Hi, my name is Dr. Vincent. Thanks for having me, 20dB, for sharing on some of the topics about ears, hearing, and how it applies into your specific condition. Yeah. All right. I will share my screen. We will have a Q&A towards the end of this session. Yeah. Okay. But allow me to start my talk.
Okay. So this
All right.
Doctor?
Can you all see the slides? Can you all see?
Yes. Can.
Okay. Can you hear me loud and clear?
Yes.
Okay. Very good. Very good. Okay, so we will have some Q&A towards the end. All right, so I hope everybody is having a good, smooth internet line. All right, so with internet, sometimes things can be a bit unpredictable. Okay, so we are actually streaming live, or at least I'm streaming live from KPJ Klang. This is the view that we have here. All right, you can see the view from outside the hospital, and I'm somewhere hiding inside the clinic. Okay, so of course, I hope I don't get caught in this situation. All right, so you probably can see me in the top half. The bottom half is anybody's guess what's there. Okay, so some disclosure. If you look at the insert, well, you don't have to pay anything for this, and you also don't have to buy anything you don't want to impress people you don't like. My disclosure: I'm not paid to promote any products or services by any individuals, organization, or even 20dB. This is purely for educational purpose. Okay. And also nowadays with online consultation being commoner, so I would also like to specify that this is not a specific medical advice to any person. Okay, this is general advice. Please consult your ENT specialist or audiologist of your choice to have a proper diagnosis, assessment, and treatment. We try our best to give you a general opinion of what's going on, what can go on, what may go on in terms of treatment. But as you can see, nothing replaces a proper face-to-face, individualized consultation. Yeah. So whether new patient or follow-up patient, it'd be good to drop by in the clinic to be properly examined and you get the right treatment. So we'll do our best to enlighten you on this ear conditions, but please consult with your ENT doctor or specialist. Yeah. All right. So when I say hearing loss, I don't mean selective hearing loss. Yeah. Okay, so I think husband and wives tend to have this issue, right? You only hear what you want to hear and you just delete the rest. Okay, just like what the picture says, you know, you only choose and specify certain words that you would like to hear. Okay, so when we say true hearing loss, we assume the patient is really not hearing well and he really has a drop in your hearing as compared to his previous status. Okay, whether you're having a selective hearing loss, I think we'll let the other party deal with you. Maybe you need a knock on the head. Okay, so just like in life, many things in life come in different shapes and sizes. Okay, you can see the ears in the animal kingdom is very, very unique. Although human ears don't have much of variety, but the animal kingdom has much more exciting ears to look at. And of course, as we evolve, we too have developed new functions for the ear too, perhaps. Yeah, and incidentally, to begin this new year, I shared this too. Yeah, Happy New Year. So anyway, how would we know that this year have ended up this way with COVID-19 and everything going on? Yeah, so it's a pretty challenging year, something unprecedented we've not seen before. So let us move on without much further ado. Let me introduce the outline of the talk we're going to have today. Yeah, okay. We're going to concentrate on the breadth rather than the depth. All right, that means we're going to talk things a bit more widely rather than deeply, because there's time constraint. The topic is very wide, so we're going to just touch on some of the very common topics: earwax, common ear infections, hearing emergencies, some to do with newborn hearing as well, tinnitus. Okay. Noise-induced hearing loss and degenerative hearing loss due to old age, or we call it presbioacusis. In some slides, probably you'll find the pictures maybe a bit gross or distasteful, not to your liking. Please bear with us because we need that for better illustration. Yeah, okay. So some of the topics that I'm sharing on will be available from my own website. You can Google this, you can snap a QR code, or you can just log into the web address that's displayed down there. All right, that topics will be described in more detail. You have all the luxury of time to read through it. Yeah, but for today, we're just going to concentrate on the salient points, some of the take-home message that you all can, pay attention to. All right. So when you go to any clinic, whether it's a GP clinic or a specialist clinic, I think these are some of the very basic tools or basic procedures we will have to do. All right. You start off with the Autoscope. If you can see on the right upper left of the screen, is a very common tool that doctors would use. We are trained from undergraduate to use this tool. All right. So with this, we're able to have a good look into the ear. You don't need any kind of high-tech fiber optic technology to be able to have a good look and view of the eardrum and the surrounding area. On the right here, I hope you can see my mouse. Right here, of course, with the advent of technology, endoscopes has come into the picture, and we are able to view a close zoom up of the ear canal or eardrum of the patient, and in full view of the patient as well, right? So in my clinic, I have two views, and in most clinics, the doctor is able to see it, patient is able to see it live, just like how we hear live stream, the patient is able to see it live as the ear is being examined. Or in other cases where we need to do procedures or even a closer zoom in into the ear, microscope is there to assist us, and we have headlights to assist us sometimes. And part of our armamentarium, or part of the team that we have, is the audiology team, where they need to, where patients need to undergo certain audiological tests in a soundproof calibrated room. All right. So these are some audiology tests to confirm or exclude some ear conditions that we have. In hallmark of modern medicine, a lot of times we follow this sequence where when we meet patient, we basically ask you about your history, the symptoms that you have, all right? So there is reason for us to talk to you. We understand your background, your symptoms, all right? And after that, we'll follow up with some examination, like I showed you some of the pictures, some tests that needs to be done, and with that only we follow the treatment. So this is general principle in practice of modern medicine, not just in ENT, in follow-up for diabetes, hypertension, heart problems. So most doctors would go through this sequence. So, okay, now let's come to one of the commonest issues that we face. If you look at the upper picture here, this is an eardrum, a normal eardrum that looks semi-transparent, looking nice. You can see it's the bone, the first, second, usually the third bone is not well seen. This is how a normal eardrum will look like. Of course, normal, there's variation, different variations, but this is one of the very good, clear view that we can get with an endoscope or a microscope, yeah? So you can see an eardrum that's semi-transparent. You can see the whole looks clean. Okay, and you can see here some earwax. Well, a common condition of earwax that could be dry, flaky, or you can sometimes get soggy earwax as well. All right, if they have some infection, something can make it even more soggy. So these are very much genetically predetermined. Okay, so but all right, I think a very important concept, probably one of the important take-home message is that our normal ear. Normal meaning to say you have a normal ear canal, the skin is normal, okay? All right, let me play this. The skin is normal, the caliber, that means the diameter of the ear canal is normal, you don't have too much hair, the skin is expected to perform normally. Meaning to say there's a phenomenon called epithelial migration. Epithelial in medical term means skin, all right? The skin is able to move from the inner part of the ear onto the outer part of the ear canal, all right? This is just an illustration of how an experiment to prove this phenomenon, where a dye is dropped onto the eardrum and found several weeks later on the outer part of the ear canal. So it's a natural occurring mechanism. You don't need to do anything about it. You don't need to clean your ear. It will happen. The normal function will be disrupted when you start indulging in your pastime. And I think one of Malaysia's favorite pastime, especially during this MCO, when people are really free, is using cotton bud. All right. Last 2 weeks, when the PM has opened up a lot more freedom of movement, I have seen so many patients with impacted cotton bud issues. Yeah, on one day, sometimes it can be up to 80% of such patients that presented with such problem. Okay, so this is definitely one of Malaysia's favorite pastime. Okay, cotton bud is widely available. And of course, some people get a bit innovative. You can shine some light, and you can buy this online nowadays. You can shine a bit of light, spray a bit of water. So the rule is, if your ear is normal, you can actually leave it alone. You don't have to do anything about it. And to have wax getting stuck inside is almost very unlikely. All right, it comes in all shapes and sizes, many different names, cotton buds, cotton swabs. All right, in the US, America, Q-tips, the name is very popular. And if you even look into their website, they have separated themselves from the rest of the manufacturers. Yeah, okay, Q-tips, a registered trademark. It can only be used as specific cotton swab. All right, so but of course in Malaysia we just use the word cotton buds, which will mean most of what these swabs, the cotton buds that are available out there. Okay, and of course these are some of the other languages Okay, so I hope this is correct. So anyway, this is definitely one of the commonest pastime, I would say, one of the favorite action that people like to do to their ears, right, which is to use cotton bud to clean their ears, which is a totally unnecessary event. All right. So if you look at it, the equivalent would be something like, doing a piling work here. So your cotton bud will be pushing the wax. As I told you earlier on, the cotton bud is the ear canal skin is able to migrate the earwax or little tiny bits of the earwax from the inner to the outer part of the ear. All right, you don't have to clean it. And remember, the head of the cotton bud is so big. In a lot of cases, you actually push them in more than you actually turn it out. Yeah, because you are hoping to twirl the cotton bud and remove the earwax in the process. But lo and behold, most of the time you don't get that action. Okay, and in most cases where you see you see wax stuck in the ear, we call it impacted ear wax. You can see here the nuggets, right, of earwax, where this is really pushed right up to the eardrum. Because in most cases, you will not get accumulated piece of earwax that much next to the eardrum. And of course, these are still my record holders, right? These are collections that I have. You can see how big chunk they are. So these are really the nuggets, the gold nuggets. Yeah. Okay. So it can be that big and gross, right? Well, when this sits in your outer ear canal, it will definitely cause you some true hearing loss. But of course, it's temporary. Once you remove it, they'll be better. But not all cases are just dry impacted wax. You can see here some of the effects. Can you see the mouse moving? The mouse marker on this upper left shows you an infected ear canal. Okay, you can see pus collection behind next to the eardrum. You can see the whitish bacterial infection debris. Okay, here also the whitish, blackish, these are fungal debris. Okay, so fungus tend to also cause excoriation of skin, so it can be painful. In fact, this morning I just saw a patient that's even more swollen than the picture I'm showing you on the lower left. All right, this lower left picture shows you that the outer skin here, the ear canal, has become swollen. Okay, there are some, including the one I saw this morning, that's as swollen as, there's no more hole. And in these two pictures down here is also the same patient. Patient had come to me with the ear block, and looking at this, you can see that the ear canal is swollen. But lo and behold, as you reach in, clean up the pus or dirt inside, there is cotton bud retained inside. So patients is not even aware of the cotton bud being left behind. Okay, and to date, I have on my record the most cotton bud being removed so far in my own practice is 3, 1 on one side and 2 on the other side. So, and the best part is patient is not even aware of it. So, meaning to say, you can accidentally retain cotton bud. Retained cotton bud will lead on to infection. Infection will cause pain, swelling, and sometimes even bad enough to cause you fever. On the upper right corner, all right, this patient has pushed in the cotton bud a bit too forcefully. You can see a blood clot under the skin. Okay, so in such case, you can choose to leave it alone, or if it's very painful and tense, you can make a small cut and drain the blood. You'll feel a bit better. Okay, so these are totally preventable issues. Totally preventable because, like I said, epithelial migration happens in most normal ears. You don't have to disrupt the mechanism. So sparing you more trouble and more donation to the doctor that you'll be seeing. Yeah, okay. So, of course, this is also another possible scenario that can happen. I have had patients that had injured or punctured their own eardrum. I have one patient who stood behind the door, and the spouse happily opened the door and the hand just got pushed a bit deeper, and the same thing happened. So you can see here on the right, this ouch, oops moment where there's 2 holes separated by the thin strand of the eardrum on the actual full eardrum itself. You can see fresh blood stain here. Usually traumatic ear perforation can heal unless it's way too big, the hole. So again, as I said, this is totally preventable condition, and also not just by accident. Fungus infection, if it's severe enough, can also cause excoriation that even cause the eardrum to be perforated. So a take-home message for you all is a normal ear can clean itself. You don't have to use cotton bud, metal hooks, curettes. I have patients who use toothpicks, keys, as per moment to clean the ears. So in fact, just leave it alone. It is human to have a bit of ear itch. You can just gently, massage the ear, the itch go away. If the itch persists, always drop by your nearby neighborhood GP or your specialist to have it sorted out. Please don't use a cotton bud. If you just would like to use a cotton bud to clean the outer part of ear canal here, is perfectly fine. But a lot of times when you do that, automatically you will also go inside and you end up with some of the issues I've shown to you earlier. All right, so I've shown you some ear infection. Can you hear me? Okay, so if there's none, I'll proceed. I hope you're following me. So I think one of the most important take-home messages is that don't use cotton buds. Don't use cotton buds. The ear wax can come out on its own. Here, I like to show you a close-up of a fungal infection. Okay, so a lot of times, fungal infection, you will need antifungal ear drops. Just by taking oral medication or just by leaving it alone, definitely will not go away. You can see this kind of fluffy appearance of a fungus, yeah? All right, you can see the fungal elements, the eardrum is right at the back here. So in most cases, the fungal infection will not happen spontaneously. You can see the flora and fauna inside here, yeah? Okay, so if now the eardrum in the back can also have a hole. And the lower picture here, there is some bacterial debris here. Okay, and another picture here is a common condition with parents. So this is something if you see your son or your children suddenly in the middle of the night, they start having pain, screaming, and this is definitely one common condition. You can see pus actually coming from the ear canal. Okay, it's actively discharging, and I will share a bit more on this in a while. But definitely, when pus appearing in the ear, many parents do get panicky and they quickly seek medical attention. But in actual fact, this is what is actually happening, where the ear is starting to discharge pus. Okay, we'll move on to the next one. Okay, so this is a common condition, call it Eustachian otitis media, or simple terms, we call it middle ear infection in an acute way. Right, you get flu, cold, runny nose. Sometimes the body is not able to clear the infection, and you will get this condition where the ear canal is red. The eardrum is, and with that you get a build-up of secretion, fluid, and eventually become pus in the ear. And it will come to a point where the pus is distending the eardrum, and it will start to leak. It will start to break. All right, so you end up with a little tiny hole like what we have shown you. Okay, in this video. All right, so this is your ear canal. The middle ear space is normally empty. It is supposed to be filled with only air. But in the event you have a nose problem, if you can see my mouse here on the middle lower picture, where nose pathology, problems, infections, that can cause your Eustachian tube to block. Subsequently, it will lead to infection and accumulation in the ear. In the space behind the eardrum. We call that middle ear infection or AIM. This is a painful condition. That's why sometimes in the middle of the night, your child starts having pain with a preceding fever, cough, and cold. This is a very badly diagnosis. Or some patients that are coming back with these problems in the ear clinic, sometimes you even have to look into the nose of the child, because there are some infection or some gland enlargement at the back of the nose that can lead to poor healing or recurrent problems with the ear. Okay, there are other, what we mentioned now was the middle ear infection or the eardrum infection. Yeah, another common cause for ear infection, or rather the common site for ear infection, is the outer ear canal, which we talk about cotton bud, or some people using the fingers, the pinky, or now everything, and so on. People use a lot of earphones. Yeah, so these earphones do not agree with the skin. You have a problem too. Okay, so do get another headphone for your ambient, able to avoid all these abrasions out of the canal. Or some period move, maybe they are falling out, probably in the issues. I have patients with this through earbuds, and sometimes hearing issues actually present. We can know of police hearing aid, especially the one that you can see in the picture here, the earmosis in the ear canal. Okay, some people have skin disease, eczema, so there's a lot of skin being checked. So contribute to such problem. Diabetic patients are known to have a higher tendency to get infection. So be very careful if the children are well controlled, or if you have minor trauma in the presence of poor sugar, your diabetes will reading will go up, and also the infection of the ear can happen. And there's a peculiar condition of the ear in diabetics. The ear infection can cause bone erosion, and leads to a lot of excoriation and long treatment in the hospital stay. Okay. Environment is depends on active compound inside each different medication. And as I showed you just now, your infection can come in from bacteria, come in the form of virus, and can come in the form of fungus. So this the owner is a patient, the doctor determine and that he will have what kind of treatment. So many times direct route of delivery is the most important, most effective tool. And here in ENT practice, we emphasize on ear suction. Okay, why is ear suction really important? Stable. Can you okay. Okay, I will just go on. If because you see here the connection is actually not. Okay, so why is ear suction important? It allows a proper inspection of the whole ear canal and the eardrum. Like I told you earlier on, diagnosis is really, really important. So with the right diagnosis, can only the physician decide on what the right medication to give you. Yeah, okay. And correct diagnosis of correct treatment and better patient outcome. And a lot of times you like to remove your ear debris is because after removal of ear debris allows a very good direct skin contact with the eardrops that we prescribe. And in a lot of times, the eardrops will actually do very, very well to eradicate infection, because eardrops definitely has a high concentration of the antibiotics or anti-inflammatory drugs, sometimes even more than the injectable ones or the oral medications. So I can show you some examples here. So hang on. Okay, for example, in this patient, sometimes even with the debris in the ear this way, it can be mistaken for eardrum perforation, hole in the eardrum. Some people has come to me being diagnosed or referred for eardrum perforation. But once we clean up already, you can see that indeed these are just the wax or the mixture around this area that makes it look like a hole in the eardrum. But upon cleaning, you can see actually the eardrum is intact, no problems. But the problem is that the whole ear's canal skin here is all red and swollen. So with this, the ear skin is well exposed and well ready to come into contact with the eardrops you're going to apply. With that, it works much faster. Sometimes, have you ever wondered why is it that you use the eardrops in a full ear, full of dirt, full of debris, full of infection? Why is it that the eardrop doesn't work? But after seeing the doctor who done your cleaning of the ear will tell you can continue the eardrops, and you'll find that the eardrops work well. That's because once we remove once we clear up the infection here, you can definitely have a better efficacy of the medication. Remember, I was telling you a direct route, okay? Or sometimes after removing, you can see that actually there is a hole in the eardrum. So if there is a hole in the eardrum, it makes a difference in the medication in the type of medication that we're going to give you. So with this, I would like to advise you as well to be really sure before you apply any kind of eardrops that you be sure of the status of your eardrum, because it makes a difference. What do I mean by that? I'll tell you in a short while. Because when you have a hole in the eardrum, you can see the space here, which is what we call the middle ear. There's a space behind the eardrum. So whatever you drop into your ear, besides being applied to the outer ear canal, being applied to your eardrum, part of it will actually go into the middle ear space that connects with your inner ear. That's where the important organs of balance and hearing is. So some of these eardrops, it may be it may be good and cheap, but it may not be safe for your ear canal. All right, not all eardrops are safe for your ear. My apologies, not ear canal. It may not be safe for inner ear. Maybe when I show you the picture, you will understand a bit better. Okay, so these are examples of how an external ear can be communicating with the middle ear and the inner ear. All right, so this is a device. In some patients, they have eardrum problems, they have middle ear problems, they have the Eustachian Tube problem. Like I told you, the connection between nose and the ear, it's not normal. So we will need to do this as a treatment. And in this right picture, you can see a large hole of the eardrum there. So this opens up the communication between the outer ear and the middle ear. So that is where problem can come. I'll tell you that in a short while. So if you're unsure if your eardrum have perforation, and especially you have active ear discharge, it's dirty, it's swollen, be very careful the eardrops that you're applying to your ear. Okay, so I think I've shown you this picture. Okay, this is the one that I'd like to show you. If you look at the outer ear picture here, you can see the eardrum is intact. The eardrum has no communication. The eardrum blocks off the communication between the outer ear, which is here, the outer ear canal, and the middle ear space. You can see in this picture, the middle ear space here, I hope you can see the mouse, the middle ear space here that contains the bone of hearing actually communicates with your inner ear structure. You can see these three half circles. These are your balance organ. This is your inner organ where the cochlea, and this, you can see this cords-like structure. These are nerves that goes up to your brain. These are your hearing apparatus. This is very important. So if you actually have a hole in your eardrum and you're not aware of it, and you actually apply ear drops that contain this component will be able to go in and get absorbed into your inner ear structures and cause destruction. And these are usually permanent destruction. Okay, you can get permanent hearing loss, you can get permanent imbalance issue. That is why a diagnosis, whether your eardrum has a hole or not, makes an important difference. Okay, some of these eardrops may be very cheap, really works very well. Okay, especially if you don't have eardrops, these are like what the Chinese would say, pang, lang, chang. It works well, it's cheap, it works great. Okay, so simply irresistible. But when you have a hole on the eardrum, the whole paradigm changes. So it's really important. That is why it's important to have a good view. If you need to do suction, remove it. So we are able to appreciate the whole anatomy of the ear better. All right, some of the common errors that we take for granted too is that patients know how to use eardrops. Not necessarily so. All right, application of eardrops, not only it has to be timely, to be used as instructed, how you use eardrops are also very important. Okay, I'll just go through here. You must ensure before you use the eardrops that the eardrops is warm to your body temperature. You can just hold the solution by hand if needed to, because anything that's too warm or too cold, if it drops into your ear, especially if you have middle ear perforation, it will go into the middle ear cavity, come into contact with the balance organ and cause some people to get giddiness. They can even get vertigo or vertigo. So after you warm a bit up, you lie down with the affected ear facing upwards. Okay, for adults, you can pull this is called a pinna. You can pull a pinna up and out. For kids, you put them down and out. Basically, the purpose of it is to straighten your eardrum. So when you straighten your ear canal. Okay, the ear canal in humans is not straight. So when you do that, you're actually straightening the ear canal. With that, you're able to direct the eardrops into the deeper part of the ear canal. Or in some patients, you will like the eardrops to actually enter through the perforation to treat the middle ear infection. So that's what you will do. Okay. So after that, you allow a bit of time, for the ear canal to soak up the solution. Okay, so you can massage here a bit, so where it mixes better in the ear canal, and after that, you can lie down for 10 minutes, even longer if you want to, for a good contact with the eardrops. So you lie down with the affected ear facing upwards. With that, the ear canal can have a good contact time with your infected skin lesion. Right? You can stay longer, but when you stand up or when you sit up, part of the ear drops, right, will sort of flow out. I think that's fine. It's okay, right? But as long as you allow a period of time long enough for the ear canal to be in contact with your skin, I think you've done yourself a great help. Yeah. Okay. I know we're having a bit of fluctuating internet signal here. I hope I'm okay. Another test that you commonly encounter or commonly requested will be what we call a pure tone audiogram, or simply called audiogram. Is usually done in a calibrated soundproof room. Okay, so with that, we're going to assess your hearing levels, and this is a chart or graph that you will commonly come across. You can see here decibels is a measurement of loudness of sound. On this x-axis will be frequency. The higher the frequency, the bigger the number, the sharper the sound. So normal human would have hearing of not more than 20 dB. Okay, so you can see as your figures go, or the numbers go bigger and bigger, your hearing loss actually worsens. All right. So if you do look at the chart on the right, okay, one for right ear, one for left ear, you will see that the lower readings or the higher, bigger numbers are indeed not good. Okay, so right and the left ear may differ. Sometimes you can get what we call a single-sided deafness. Okay, I think a very important message I would like to share is this condition called sudden sensory neural hearing loss. Okay, strictly speaking, the definition based on this audiogram is 30 decibels or greater over at least 3 frequencies, contiguous frequency occurring within 3 days or less. Don't worry about this. This is not for layman, but this is for the doctor that's treating you. Okay, so this SNHL can come in peaks, just like a viral infection. Now we have COVID. A lot of times we have influenza. So these are like just any other viruses. They can have peaks. They can have sudden spike in the number of cases a certain time of the year. In my practice, I saw that spike somewhere in July, late July, early August last year. There were a lot of such cases. So it's really indeed important for the general public to be aware of this condition. It was a bit alarming, so much so I even posted on my clinic Facebook page to just warn of such conditions, because this is really indeed an important condition for you to be aware of and to treat early. In ENT, there are not many emergencies. Okay, my senior used to say ENT stands for every night Tido. You know, sometimes when we do on call, most of the time we just sleep because we hardly get called for any emergencies as compared to our orthopedic colleagues, surgical colleagues. But in ENT, this is one of few emergencies. Yeah, besides people having problems, cannot breathe, bleeding, this is one of those emergencies that we would like to treat as soon as possible. All right, so this is another anatomy view of the ear. Okay, of course, this is in a model. I've shown you just on the outer ear, the eardrum. Of course, the eardrum is really thin. This is the communication with your nose through the Eustachian tube. your nose, the back of your nose is here, the middle ear is here. Two very, very important organs that you cannot see from outside, but we can assess function for is your cochlea, that looks like a snail, and here is your balance organ. Okay, so this is your balance organ here. You can see there's 3 half circles, so these are all very, very important structures. The balance organ that comes in 3 circles controls your balance sense, and the cochlea here, all right, the snail controls your hearing sense, okay, sense of hearing. So if, for example, you've had this before, I can speak to you as a patient who has experienced this condition before, but thank God mine was just a mild SNHL that I recovered. So this is important for you to know. If you are very sure you suddenly experience a hearing loss, okay, with or without and sudden onset of giddiness or vertigo. Vertigo means your surrounding starts to spin. Okay, this, if you have consistent tinnitus, you get ringing sound. If you have a combination of this, I would suggest that you see a doctor as soon as possible. Okay, because you may actually have this condition. Okay, this is where we need to rule out inner ear infection. All right, there are other medical terms here, but don't worry about these terms. This is left to your doctor to manage. But from a patient point of view, you got to be aware of this dangerous trio where you suddenly have a hearing loss, you get a sudden ringing sound with, okay, and stroke or giddiness vertigo. So because if you have an inner ear infection, it can lead you to permanent irreversible hearing loss. And any kind of permanent nerve damage that I showed you from the picture just now can lead to long-term, lifelong tinnitus that's probably even not treatable. Okay, there is a slight difference. I showed you the 2 organs, depending on which organ is involved. Both organs are involved, some only involve either the balance organ or the hearing organ, the cochlea. There are unfortunate times where the cochlea and the balance organ are both affected. So your problems are consisting of balance issue and also a hearing issue. And in such case, your ears are normally dry, you don't get pus, you don't get fluid coming out from your ear. You may just feel that it's an ear block, all right? Especially for mild hearing loss, you may not be even sure whether you lose your hearing. I can speak this from my experience as a patient. So it just feels like an ear block. There's usually no pain, don't expect fever. You can this can also happen in young kids. Of course, young kids is hard to determine. It can happen in adults. The reason why you need to see a doctor, because there can be other conditions that mimic this as well, as simple as wax getting stuck in your ears, outer ear canal. So again, I'm not trying to raise an alarm here, but there are certain cases where the trio that I told you, sudden hearing loss, you get giddiness, vertigo, and a sudden onset of tinnitus that you know you have never experienced before. Please seek early medical attention. This is from my experience as a patient. Okay, so I have treated this as a doctor, but never would I expect to be experiencing this as a patient. But I'm happy to say mine was a temporary infection, and I overcame that. So this was my first experience doing an audiogram as a patient. All right, this is actually an audiogram in progress. You can see this is a soundproof room, the patient's inside, and of course in this case the patient happens to be me. So you have this sort of like headphones over your head, and sometimes there's something we call bone oscillator sitting at the back of your ear. So this is to complete the proper hearing assessment. So it's really, really important, especially where patients are a bit unsure. I can show you, this is based on real case scenario where this patient came early with a hearing loss, and this is documented. When we do a hearing test, you can see that the hearing level actually dropped significantly. Remember, I was telling you, normal hearing, the hearing level should not exceed 20 or around 20, 25. So like this, we assume we can take this as a normal, or although there's one at the borderline, but some of these are very minor. Observational difference is fine, but what is significant is here. So good that this patient come for treatment, and we could institute the treatment straight away. And in this case, the patient recovered to full normal hearing. But of course, we cannot guarantee this for all patients. Just like what we can advise is the earlier you seek the treatment, the better the chances are. Okay, sometimes by the time they come to us, the hearing loss has already been there for 2 months, 1 year, 5 years. Unfortunately, there's nothing much that we can do by then. Yeah, any kind of nerve damage, like in this case, it's a nerve damage. seek early treatment, because early treatment determines your level of success. Okay, so take-home message for you all is seek treatment as soon as possible if you think you have this entity called sudden sensory neural hearing loss. Okay, and of course, I think many may not have heard of that sudden hearing loss, but usually the common thing that strikes fear in people is called the big C. Okay, big C stands for cancer. Okay, cancer. A lot of times they come here, they're worried about cancer, they hear their colleague has cancer, the family members just got cancer, suddenly diagnose cancer out of the blue when they're so well. But of course, at this point in time, the other C can also stand for COVID. All right, I'm not talking about COVID here. We hope this doesn't stay on for too long, but cancer will be with us maybe longer than all of us in our lifetime. Yeah, so cancer commonly strikes fear. Fortunately, ear cancer is not common, but there is a common cancer that can present as an ear problem. What do I mean? Okay, when this news came out, everybody was very surprised. Indeed, Dato is an inspiration among many, but however, we have to accept the not so good news that even our hero can sometimes, be afflicted with cancer. But the truth is, nasopharyngeal carcinoma or cancer is indeed common in our community. In fact, I posted this too. So happened his acronym works really well. Don't let cancer win. Yeah. Okay. So glad to say Dato has overcome this. But the truth is that NPC is common in our community amongst the Chinese, amongst the Iban Bidayu community in Sarawak as well. This will likely be around for a long, long time. Let me explain a bit more to you with these pictures, especially in the West Malaysia here. Chinese will definitely be high up on the list. That is why we need to understand why in some cases when you have nose problem, we like to look at your nose, all right? Because the nose and the ear communicates through what we call the Eustachian tube. In these real life pictures I've shown you, you can see the opening in the nose, the back of the nose. This is the opening of the Eustachian tube that leads on through the Eustachian tube to the middle ear. This is the back of the nose. We call it the nasopharynx. You can see these deep recesses or deep grooves here, or on this picture in the middle. This is the beginning point of where nose cancer starts. All right, so you can see its deep groove is right in the middle of the head. That's why we need an endoscope. If you can see on the left side here, to go right into the nose to really see what's going on. Sometimes when patient come with us with one-sided hearing loss, you can see here on the lower picture, you can see bubbles. You can picture the bubbles here. Like I said, the middle ear is supposed to be filled with only air and not fluid. If you have fluid in your ear, it feels like you are in a swimming pool, your hearing is decreased. So this is what actually patients will come to us with. You can hear lesser on one ear. So we really, really have to be sure. I told you about sudden sensory neural hearing loss. That's one cause only. But sometimes you can have causes like this. The nerve is not damaged, but the sound transmission is affected. Like what we call this is conductive hearing loss, because there's fluid in the ear. We call this glue ear. In fact, you can see here, there's air up here, there's fluid down here. All right. So a normal ear, you will not get fluid condition like this. So for a patient that has NPC, this can be all that they come to us with. They only come to us with an ear problem. Okay. So you can see if you put a scope into the nose, sometimes you can get lymphatic tissue growth. You can see this even in small kids, or sometimes you can come and appreciate the bleeding lesion. Lesion means a pathology in the nose. This is usually back of the nose. There are other conditions as well. Sorry if you find this gross, but this is real life pictures. These are real life events that happens. All right. Some patient may not have other symptoms. They will just come with very large nose, neck swelling. Nose is in fact very well, no blood stain, no blockage, only a neck swelling. So again, the onus is on the doctor to find out what's the cause of this swelling. Okay, we can do a biopsy of this. We can look at the nose. All right. So some will come with squint of the eye of a new onset. Some will come with change in the voice, because all the nerves near the back of the nose are all affected. I've shown you this picture where there are bubbles. Okay, so what do? We can use a scope that looks through your nose. Of course, this is just a model that, through a flexible scope. This is a real scope. Okay, this is a model, and this is a real life. All right. So what I'm trying to show you here is, as we go towards the back of the nose, you can see this. All right. In this case, good thing, it's not a cancer. It can present with a one-sided hearing loss. This is in fact in a small kid, yeah, where the lymphatic tissue, which is what we call the adenoid, sort of grows too big to the point that it blocks off the opening of the Eustachian tube, which is supposedly here, in this picture, and cause one-sided hearing loss. Glue ear can happen in one ear, can happen in both ears. It depends on how much blockage is there at the back of the nose. You can see through endoscope here, a flexible one that we do for kids. We can actually know this for sure. All right. So if you have your kids snoring gloriously every night, they'll be snoring, breathing out through their mouth, not breathing well, toss and turn at night, please check with your ENT doctor, because sometimes the only problem is right at the back of the nose. The nose in front is normal, the throat is normal. Okay, so this picture down here is a view of what we'll do if we suspect there's cancer. We take a biopsy. You can see here a grasping forceps. We just take a biopsy to confirm whether it's cancer or just lymphatic growth. Lymphatic growth, like in this case, the adenoids, can be something non-cancerous. Okay, but at the same time, we also have to start some treatment. I've shown you audiogram. All right, we're going to switch gears a bit. All right, we have talked about adults. Now we're going to go into another group of the community, children. Give me 10 seconds, I'll just drink water for a while. Okay, to the technical people, if there are problems with transmission, please let me know. Okay, I'll try and look into it. That's the new normal, where we have to Zoom, we have to do a lot of webinars. Sometimes we are so dependent on the internet speed, and this is really factors beyond my control. Okay, so I apologize if there are actually transmission issue. I hope the message goes through loud and clear. All right, so this, I've given you a link now there. Basically, it's trying to say, if you suspect your child to be having hearing loss, please look out, please be alert for it. Some of the signs are not so obvious, but if you pay enough attention, you can probably pick up something. All right, you can see that the child may have difficulty understanding people. They may strain to hear, or sometimes you ask A, they'll answer B, or you realize the TV volume especially high, they don't perform well in the class. Behavioral issues, some can be very subtle, some can be very obvious. So if it's obvious, do not delay, please seek early appointment, or if you're not sure, please check again with your doctors. All right, so here you say for a kid at different stages of their life, they would be able to achieve different capacity, different capability. So if you think your child do not reach these milestones, again, please be on the lookout, get them screened, get them checked out. Right? So especially for young kids, they may not be able to tell you hearing loss, so it's very dependent on the carers to be aware of what they are deficit. So you get a snapshot of this, everything. But nowadays, the good thing is there is a simple test that we can do. It's called an OAE or DPOAE, or in most hospitals now, private and government, you'll be able to do this test soon after the baby is delivered, before your discharge. All right, it's just a simple test. There's no need of response from your child. It's very specific, sensitive enough to pick up early stage hearing loss. All right, and these are usually nerve hearing loss in a child. So you like to pick them up early. If you look at the book for delivery, sometimes they put there ujian saringan pendengaran, or some places they will use newborn hearing test. Normally, they will not use the term OAE because those are very technical name of the test. But now this is widely available. It's not expensive at all. It gives you great assurance that your kid is hearing well. And with that also, sometimes the doctors may want to identify some of the high-risk group patients, whether there's family history of hearing loss, some other factors like prolonged jaundice, which can contribute to hearing loss. So I think many times this is widely available. Please ensure that your baby gets a hearing screening test. Neonatal is less than, so basically you get the test. So maybe we can hearing test. Rosita, you be able to share something on hearing test for neonatal screening? Rosita? Okay, I think the line may not be that great.
Yeah.
Rosita, can you share? Can you share on a hearing screening?
Okay, all right. So let me share my.
Yep.
You can see. So I will talk about a bit on neonatal hearing screening. Okay. So this is important for the parents to know the hearing status of their child because the first 3 years of life is very crucial and important for the child to develop speech and hearing. And the detection of the hearing loss will minimize the impact of the hearing loss. So the aim for the neonatal hearing screening is to detect hearing loss before the age of 3 months and provide appropriate intervention before the age of 6 months. So the early intervention is either hearing aids or cochlear implant. And this is the standard test used in neonatal hearing screening, automated AABR, and also OAE, like Dr. Vincent mentioned earlier. So both of these tests are very safe to the child. It's non-invasive, just need the child to remain calm during the test, and it will give out result like either pass or refer. So if it pass, means that the child have adequate hearing to develop speech and language, but they still need they still need monitoring and evaluation. So if they refer in the screening, it means that they need further audiological evaluation so that they can get earlier intervention. Okay.
Okay. Thank you, Rosita. So I'll switch back to my view now. So, how do I share this? Okay. Hang on. So I share my screen now. Yeah. All right. Can you all see my screen now? Okay. So,
I think your connection is
I think
not
common.
very stable.
So say again.
You cannot see your slide. Okay,
Okay.
now it's come back.
Okay. Sure. Okay. Let me share this. Okay. Can you see the slides?
Okay.
Okay. I think let's continue. All right. One or two more topics to go. So tinnitus is a very commonly encountered symptom. It's defined as perception of noise or ringing in the ears. It's not really a disease or illness. It's more of a symptom that comes within the own auditory pathways. All right, that means the whole ear system. Sometimes it's even associated with issues along the pathway to the brain. It's often assumed that tinnitus occurs as a result of disease in the ears, but this is not often the cause. despite the advances we have made in science, the actual cause of tinnitus is still not fully understood. We know it has something to do with nerve injury, nerve damage, and some hearing deficits. In fact, it can be a big chunk of wax sitting in your ear, blocking your ear canal that give rise to this problem. Even that can cause tinnitus, but those are reversible causes. Indeed, there are many causes, too many for me to list here. Any kind of ear problems can cause tinnitus. There's also tinnitus that's linked with a bit of psychological disturbance of the patient. There are many medications that cause that too. So I think it's best to leave it to your doctor to identify the cause. And in many cases, there are also no cause identified. That is why tinnitus can be sometimes a very troublesome symptom for the patient. The patient is annoyed with the sound. The doctor is frustrated that there's no medication, there's no treatment. So indeed, that's the reality for now. A lot of times you say, relax, please relax. We look for the underlying cause. We will try to treat the underlying cause. Again, I think I would like to pass this part of the talk to the audiologist, because here the audiologists also play an important role. As surgeons, as ENT specialists, there's limit to what we can do, but audiologist input is very much appreciated here. Rosie?
So like Dr. Vincent have mentioned earlier, the exact cause of tinnitus is usually unknown. So from our perspective, the audiologist, patient with tinnitus and also hearing loss will benefit from the use of hearing aids. And nowadays, hearing aids have already included with masker, so they can treat the hearing aids, treat their hearing loss and also the tinnitus. And I think the counseling plays an important role also in the treatment of tinnitus, because the patient have to understand and learn how to cope with the condition. Okay. And most of the time we also counseling about to reduce the possible irritants, cover up the noise, and also manage their stress. That's all. And I think back to Doctor.
Okay, I shall continue. I'll share my screen. Okay, can you all see my screen?
Okay, can.
All right. Okay, along with tinnitus, one of the reasons of tinnitus is actually hearing loss due to noise, too much loud noise exposure. If you're in the industries that deal with a lot of environmental ambient sound, it's very important for you to be aware of the sound exposure versus the duration you're exposed at that particular decibels. Remember, I was sharing with you the audiogram chart. You look at the numbers here, these are pretty big numbers, yeah, 90, 92, 95, and so on, right? So these are really loud noise, all right? So here on the upper level, these are the numbers. If you can still keep the image of the chart in your mind, you can see, you can know that the numbers that we mentioned here are all numbers at the lower part of the graph, and these are very loud noise. So please be aware of how much sound, or nowadays you can measure the loudness of sound in your environment using a sound meter to know the decibels that you're actually exposed to. Rock concert, all this, standing right in front of the stage is fun, but it may not be so much fun when it gets tinnitus, you can't hear well for the rest of your life. So indeed, the louder the sound, the shorter the recommended time of exposure. So please be aware. I think this chart is very useful, especially if you are exposed to loud noise in a workplace. Yeah. So because for people who are exposed to loud noise, you will indeed need some PPE, personal protection equipment. Okay. So you can see here, rock music, what it can do to your ears. All right. So well, it's fun for the short term. Tinnitus is a music, or rather a noise, you do not want to have in your ear for the rest of your life, especially because it can be long-standing. There's no real medication. There are many medications that can be tried, trial and error, but a lot of times we cannot guarantee that it will even work, despite the advances of science that we have achieved. But for treatment of tinnitus, it's a bit far behind still. Very often, I always tell my patient, if you want to get rich, one of the surest way of getting rich is to find a good cure, a definite cure for tinnitus. You are definitely, laughing away to the bank. But unfortunately, many people are still not able to do it. There are a lot of research, but none that has come into the public space yet. So we have to watch the space still. Yeah. So be aware your loud music that you're enjoying can be an issue for you, can cause tinnitus, hearing loss for you in the future. So please be aware of the loud noise that you have exposed yourself to. So because this loud noise, or we call it NIHL, also causes damage to your nerve. And as we have mentioned, damage to nerve is usually permanent. So mind the loud noise, it can cause irreversible damage. Okay. And another condition I showed you just now, well, sometimes you can pretend that you want to hear certain things, you can't hear certain things, you only hear the things that sound sweet to you. All right, there's another term called bioacusis, okay, where this is actually a common condition, especially in the old people. So when we are old, we go into degeneration, our nerves don't function well, our body parts goes into dysfunction, so we no longer hear as well as we can. And usually for bioacusis, if you remember the chart that I showed you, again, we start losing our hearing capacity at the higher frequencies. Okay, so just as the joke here, so sometimes you don't hear doesn't mean others don't hear. That's because your ear has started to deteriorate and you need hearing aids. Okay, you can see now again, hearing aids technologies, as technologies advance, you have better options for you to actually hear better. All right, from different models of the ear hearing aid. You have in the ear, behind the ear, in the canal. Again, I will ask Rosita to explain a bit more, all right, in the management or the usage of hearing aids. Over to you, Rosita.
Okay. So for patient with diagnosed with hearing loss, they will benefit from the use of hearing aids. But to recommend when is the exact time when they should get hearing aids, is there is no strict criteria. It's as soon as they get diagnosed, they get a hearing aids for them. Okay. Nowadays, hearing aids have developed so much. Better technologies are coming, and there are certain features that will help them to hear better, hear soft sound again, and also hear louder sound but at a comfortable level. So most hearing aids today have direction specific microphone, improved speech processing strategy, and also the availability of customization option. But for the elderly patient, sometimes they will feel shy to wear because they hear it so big and they cannot manage. But actually, if they come to us, we will have a counseling and consultation. We let them know we will first assess their hearing level, and then let them see what type of hearing aids available, and then let them try, and then they will manage by time. Okay, I think going back to Dr. Vincent, maybe for a summary.
Okay, I think we'll come to the end. Like I said, it's a big topic altogether. There are many topics we are trying to cover, but basically, I think the take-home message is that get the right diagnosis. Only then can the right treatment follow. Can you all see my slides?
Yes.
Okay. Right diagnosis leads on to the right treatment. Because treatment effectiveness, efficacy can differ between different patients. I already told you the entity of sudden hearing loss. Now that hopefully you're a bit aware of it, please consult your ENT specialist should you have suspicion of you yourself having sudden hearing loss. It's very important. Probably this is one of few ear emergencies. Like I said, the big C, everybody's worried about the big C, okay, especially one-sided hearing loss. Please be very aware, get yourself checked also in the nose, yeah, not just the ear. These are totally preventable. Cotton bud usage causing ear infection, enjoyment of loud noise music, or to a certain extent your noisy workplace. Please do actually wear PPEs because these are preventable causes. Yeah, you wouldn't want to have hearing loss for life because of this. And remember, hearing loss can occur in all ages. Children, they may not tell you, so it's up to the parents to pick up as well or get it tested for sure. So again, this is a link I'm sharing with you. Some of the things that I said, you can find it in greater detail over there on my webpage or my Facebook page. So I think with that, I thank you very much. I do apologize. The signal of internet, the internet strength here fluctuates a bit, but I'm ready to take questions. If you have questions, you can email it to me. I put my email there. I'll be glad to answer the questions to the best of my ability. So thank you very much. Again, apologies for the internet issue.